and we're so happy to be here with you today to do the second part of the vaginal microbiome and why it matters so much for Black women and families. Today, I'm super excited to be joined by our Chief Science Officer, Dr. Kimberly Capone, who I love to be with and learn from all the time. I'll give her a moment to let her introduce herself, and then we can get on to the education. Kim, do you want to just give a little background?
Sure. Hi, everyone. I'm Kim Capone. I have a PhD in microbiology and immunology, and I've been working in the microbiome space for the last 15 years and been working with Wendy for the last 2.5, working on vaginal health and the microbiome. And we are very excited to share what we know with you today.
So let's go to the next slide. The human microbiome is one of the most interesting organs in the body. And it is, in fact, an organ. We think about it most oftenly when we talk about the gut microbiome, but basically anything you've ever learned about the gut microbiome also applies to your sinuses, your oral cavity, your mouth, and your vaginal and rectal areas. They're all the same kind of tissue, which is a mucous membrane, and each area contains billions of bacteria that make up what is the backbone of your immune system. So we're going to be speaking about the vaginal microbiome today, but understand that your microbiome is 3 pounds of bacteria that lives and works in your body, or for many of us doesn't work for us in our body. And we're going to understand a little bit more about why that's so important when we think about vaginal health. Next slide. I feel like we missed the vaginal health side, the vaginal microbiome
It's coming.
side.
So we added some background here. Why don't I take this slide?
Yeah,
so,
okay.
Wendy just introduced what the microbiome is. And so I wanted to share how we actually measure the microbiome. So historically, you may all be familiar with how we would culture bacteria on Petri dishes. And that has a lot of applications in medicine. But now we have sequencing. And so, in order of essentially history, we started with quantitative PCR. So quantitative PCR allows you to detect a particular organism based on primers that you design that measures just that DNA that specifically matches that bacteria, allows you to amplify that and detect these bacteria in a diagnostic way. And this is used right now in medicine all the time. And once we started looking at the human microbiome, we started sequencing using additional techniques. And those are 16S RNA sequencing. That was one of the very first. And that's looking at sort of really just the genus level. So when you hear about Staphylococcus aureus, it really is just measuring that it's Staphylococcus. You can't really depict species level information, but it's low cost and it's a good way to get a scan of what's present in the microbiome. But shotgun sequencing is really where the future of the microbiome work really sits. And that is what's called whole genome sequencing. So that's measuring the entire genome of the microbiome and all the various genes, their functions, so you can predict what they're doing and get a better understanding of what the microbiome looks like. And this is what we use both PCR and shotgun sequencing in vaginal microbiome health to understand what the microbiome looks like. So there's different uses of these, and we can get into some of that as we continue in our talk. Next slide, please.
So here we can talk about what is the vaginal microbiome, and I'll start from just the most basic level, but the vaginal microbiome is literally the community of bacteria that makes up your health or lack of it in your vaginal area. And again, like I said, it's not like a vaginal microbiome is separate from the gut or other microbiomes in your body. They all talk to each other. So Kim, do you want to say a little bit about how the microbiome functions at its highest?
Sure. So, the vaginal microbiome is unique because it's a unique organ in the human body, and it's really driven by the pH of that environment. So an ideal pH is the low pH around 4, let's say, and that is because it's dominated in that situation by lactobacillus organisms. Lactobacillus are lactate fermenting organisms, meaning they produce lactic acid, and that's what's driving the low pH and allowing these organisms to take up space there and compete away pathogens that don't like that low pH. This is why low pH is often considered a healthy environment for the vaginal space, because it's keeping the lactobacillus healthy and preventing other organisms from competing with them in that environment. And all of this has been evolutionarily designed to keep the environment healthy, the vaginal tissue resilient and safe, and the organisms doing what they do. And so it's very sensitive, nonetheless, to hormones, inflammation, stress, various interactions with the vaginal microbiome can cause disruption. So having a robust lactobacillus dominant microbiome can be helpful. Next slide.
So this is really important, and I think Dr. Kim is the best one to explain it. But let me again just do the easy thing, which is that even though we know that it's true that women are in these different community states, we don't really know why some women have the healthiest makeup and some women don't, right? We haven't ever done enough research on women and their vaginal health to really understand that. But we do know that this is true, that the vast majority of women are in compromised community states. And so, Kim, why don't you tell you a little bit more about that?
Sure. So, the work done by Dr. Ravel and others during the Human Microbiome Project in vaginal microbiome research really characterized what we call community state types of the vaginal microbiome. Community state types really are defined by the dominant organisms found in those samples of the microbiome of that woman's particular vaginal system. And so there's 5 general CSTs. There are a few more, but in general, there are 5. And so CST1 is dominated by Lactobacillus jensenii. That is a lactobacillus that's considered protective, produces lots of lactic acid, hydrogen peroxide, keeping the environment safe and preventing these pathogens from colonizing, as I was saying earlier. Sorry, that's CST5, my bad. CST1 is dominated by Lactobacillus crispatus. CST1, they started with CST1 and crispatus because it's really the gold standard lactobacillus. It produces the most lactic acid, so acidifies the vaginal environment to the greatest degree. So they characterized that at the time as the most healthy CST that exists. But there's a lot of bias that goes into this research, so we'll touch on some of that as we go. CST2 is dominated by Lactobacillus gasseri. So just like I was saying with jensenii, gasseri also produces lots of lactic acid, hydrogen peroxide, considered to be a stable lactobacillus dominant microbiome CST. And then we go to CST3. This CST is dominated by an organism called Lactobacillus einers. And Lactobacillus einers is a lactobacillus, so they produce, the same kinds of compounds as these other lactobacillus, similar biology, but its genome is truncated, meaning it's lost some genes, and it doesn't have the genes that produce lots of lactic acid. So it produces some, but not enough. And so it's often that CST3 has a little bit of a higher pH than the other lactobacillus dominated CSTs. And incidentally, this tends to be the one that's most dominant in women of color. And so it's an interesting aspect of the biology that we'll touch on more and understand more as we go. CST4, which we'll end with here, is not dominated by Lactobacillus species at all, and is really characteristic of what you would see in a BV type microbiome, so bacterial vaginosis. So it's dominated by anaerobic bacteria that are Gardnerella vaginalis, Adipobium vaginae, and Prevotella organisms. And all of these do not like low pH. The pH of this environment in this CST is typically higher, and they produce lots of things that cause inflammation and issues in the vaginal environment itself.
Okay, let's do the next slide. So this is a really important way to understand why the vaginal microbiome is so important and why you want to take time, especially during pregnancy, to make sure that it's regulated and what we call eubiotic. Because if it's not eubiotic, it's dysbiotic. And that's what Kim was just describing on the last slide, where the microbiome is dominated by bad bacteria. What I mean by bad, meaning that they tend to create more toxic situations. So there's 3 ways that the microbiome protects you. So do you want to talk about that, Kim?
Sure. Yeah. I mean, I think I'll just reiterate on these bullets here. As I said before, Lactobacillus maintains this acidic pH, and acidic pH, low pH, is part of how it's protecting that environment. As it's doing that, it's protecting the vaginal integrity. The tissue is healthy, it's functioning properly, it's not being colonized by bad bacteria. And all of this is helping regulate the immune response there to prevent overgrowth of other bacteria. So that's the first box. It protects against infection through the mechanisms I just described. And this is also helpful. So in pregnancy, the hormone rush that you get, the estrogen, helps to support a dominant lactobacillus microbiome. And that's part of the reason why in pregnancy, women tend to have fewer problems with various infections, et cetera, because it tends to be a more lactobacillus dominant microbiome. If it isn't, and that microbiome remains in a more CST4 BV-like microbiome, it can have implications in that pregnancy because, again, it's driving inflammation in the vagina, and in a pregnant woman, that can cause additional problems. It can also shape reproductive health. So even before a woman gets pregnant, the kind of microbiome that is established in her vagina can influence how well she picks up other organisms, how she's influenced by STI risk. So if you have lots of lactobacillus that are protecting that environment, your STI risk goes down. But if you have a BV-like microbiome, the STI risk goes up. So all of these things are influencing vaginal health long-term and during these various parts of one's lifetime.
Okay, next slide. So I think we kind of already talked about this, but to be a little bit more specific for the science lovers among us, there's 4 ways that that the microbiome protects you. So, one is that it becomes a natural antibiotic, right? Which is what Kim was saying before. So when you have a lot of healthy lactobacilli, it creates this cycle of hydrogen peroxides that kill and bacteriocins, which are like things that kill the bacteria, essentially. Also, the lactobacilli coats the vaginal lining, and so it blocks the pathogens from attaching and getting into your epithelium. And it's also, like we were saying earlier, it requires a low pH for this system to work. But the low pH is literally the system which kills the bad bacteria. So to whatever extent that we can maintain a low pH in the vagina, then you're leaning towards health in that way. That's where healthy bacteria thrive and bad bacteria die. And last, they really help to calm inflammation and strengthen your defense against STIs, like Kim was just saying. So, having a healthy vaginal microbiome is so critical, not only to your core health, right? Like microbiome, immune health, but also how you feel, right? Because when you have these bad bacteria, you feel bad. It feels bad all the time. Kim, anything I missed there that you would want to
add? Absolutely true. Keeping a low pH helps the system find its own balance. Having lactobacillus dominance is also driving that. Yeah.
Right. Okay, so let's do the next one. Okay, why don't you do this one?
Sure. So, we were just talking about how important it is to maintain these defenses. So what happens when these defenses are lost, right? So as lactobacillus goes down, the pH and other bacteria can come into that ecosystem. And so how are these, influenced? So stress and inflammation can alter immune signaling. So your whole body is connected, as Wendy was saying. We have microbiomes in various parts of our body, but our feelings, the stress and overall inflammation, or inflammation just in the vaginal environment itself, can alter our immune functions, and that can affect the vaginal microbiome and its balance. The protective lactobacillus then decline, pH rises, and BV-associated bacteria can thrive. And these all have chronic, sort of risks around inflammation, BV itself, STI risk, and also preterm birth, preterm abortion that we'll talk about later. But all of this chronic stress, including racism-related stress, can increase this inflammatory signaling, making the vaginal microbiome harder to stabilize. So the whole point is that it's not just the organisms there, it's the biology, you're stuck with it. It's your environment, it's how you're feeling, and it's what you're interacting with in your environment that can influence all of this.
Right. And so, like, let me just say one more thing about that, right? Like, this is where your gut microbiome is really influencing your vaginal microbiome because the foods you eat, whether they're supporting healthy bacteria or, are pro inflammatory, like sugar and alcohol and other things like that, are also going to heavily influence what kind of bacteria lives in your vagina. So, it's like it is a lot of things. And there are things that we do have agency over. Okay, next one. So this is one of my favorite slides. And we kind of just sort of let it right into it. That, there's so many things that impact a healthy microbiome, so for sure your nutrition, exercise, stress levels, like we were saying, some medications like antibiotics and hormones really affect your lack of them really affect your microbiome. When you're having sex, whether it's protected or unprotected, when you menstruate and the lack of menstruation and menopause, any STIs that you've had historically or that you might still be fighting, and also the use of products, which many people don't think really affects you, actually has a huge impact on the health of the microbiome. And so you see on the left side of this slide all the things that you can experience when your microbiome is imbalanced. So, these BV infections that can just be recurrent or chronic, UTI infections that just keep coming back and coming back. A lot of women have dermatological conditions like lichens or unexplained pain in their vulvar area. And reproductive cancers even are connected to your microbiome health. So, so let me just say that your microbiome health is so essential to your reproductive health in a near term and long term way. Did I miss anything, Kim?
No, excellent.
Okay, let's do the next one. Okay, why don't you talk about this one?
Sure. So I mentioned this a little bit at the beginning, but lactobacillus are important for the vaginal ecosystem, but not all lactobacillus are the same. So lactobacillus crispatus, at least in all of the studies that have been done, both in vivo, so in human women, and at the bench in the laboratory, it is the most protective because it produces the most lactic acid, and it acidifies the vagina the most. And they also produce, these organisms, as Wendy was saying, produce other things. Bacteriocins are like antibiotics produced by bacteria to kill each other and kill organisms they don't want around them. So they produce all these elements to maintain their environment and to keep that safe for them and to compete away anything else. So the lactic acid is really the driver of what is driving that low pH and keeping that environment stable, along with these other things that they produce. So that's considered the gold standard. But there's a lot of research that we still need to do in this space. But this is what's known today. And then, as I mentioned, Lactobacillus iners, I highlight this because, as I mentioned, this CST, so the one dominated by iners, is the one most common in women of color. And so the question, about BV risk and the incidence of vaginal issues in women of color can, to some degree, be looked at through this lens of they have a lactobacillus or they may have a lactobacillus that is less protective because it does not produce as much lactic acid because it's lost some of the genome that the Lactobacillus crispatus has. This is just evolution over these organisms. It's more fragile as a result of that. And it's more easy to tip into different states because it can't create that really strong protective environment. So it's important to just understand in general that many women may not have the right lactobacillus, even if they have the healthy microbiome that they got from their mothers and have had their whole life. It may just not be doing enough lactic acid production. And there's ways that we'll talk about that we can augment that with products and other interventions.
Okay, next slide. And this is kind of an interesting, this is another angle about the way to think about the microbiome. So Kim, do you just want to walk through how the microbiome changes in all these different periods of our life?
Sure. Yes. And this is largely driven underlying all this by your hormones, right? So when you're a child, you don't yet have lots of estrogen in your system because you're still a child, especially obviously a female. We're talking about females here specifically. So the microbiome is not yet lactobacillus dominant because there are other organisms present there that, you're picking all these up through the birth canal, through exposure to, the other organisms in your family members, your mother, et cetera, over your early childhood. But it's not yet lactobacillus dominant. Once you hit puberty, your reproductive years, that's when the hormone surge happens. Estrogen, it increases in your body, and estrogen specifically is driving lactobacillus dominance. And it does that because it's causing production of glycogen in the vaginal mucosa. And glycogen is a sugar, basically, that these bacteria eat. And they eat that, and then they produce lactic acid. So you can see how estrogen is driving this ecosystem. Then, there's instability that happens during reproductive years, of course, as Wendy was saying, through sex and menstruation. All kinds of things can influence the microbiome. But once you get to pregnancy, again, the dominance of hormones in that system, in that environment, often shifts to a lactobacillus crispatus dominance. Even women who may have an Einer's dominant microbiome, if they have crispatus in their system and they have lots of estrogen during pregnancy, their microbiome may shift to be a more protective, if you will, environment. But it also may not. It depends on their unique biology. But this is what protects in pregnancy. It's evolutionarily designed to protect that environment from exposure to things that would affect the baby. And then in menopause, of course, you have declining estrogen, and that is then going to take away the food source that the bacteria are metabolizing. That's why lactobacillus go down in number, and it raises the risk of all of these other complications like BV, but also urinary tract infections. Again, because you don't have the low pH and the lactobacilli really protecting that environment. And all of these shifts and changes are happening over your lifetime, and it's cumulative. They accumulate over time because everything doesn't go back always to baseline. There could be, small changes that affect the evolution over a period of your life. So understanding where you are in any of these states can be important to help shift where you're going to be later in your life.
Great. So next slide. But we know that like being in that state creates more health challenges, vaginal health challenges for women of color. And certainly we see this most dominantly in the preterm birth rates and miscarriage rates in Black women. And the association of BV, right? Like many Black women have BV almost perpetually. And, of course, then the social and environmental factors that we already discussed earlier that are also sort of accelerating this already challenging space. So, Kim, I don't know, would you say this the same way, or is there anything that you would add to this?
No, I would. I mean, I think that the point is that there's a component of the incidence of L. Einers being higher in women of color, but there's confounding factors for all of this. And so the idea that your environmental factors, stress, your environment, your access to care, access to understanding the things that we're teaching you today, all of that is going to influence how the microbiome is shaped. And so we can do a lot, I think, to educate and to shift that to some degree.
Right. Okay, next slide. So do you want to talk about this a little bit, Kim, then?
Yes. So, I know that we're reiterating this, but it's intentional to help you understand sort of the background of why you hear a lot about the fact that women of color have more of these issues. It's because they inherently have more non-L. crispatus dominant microbiomes. They have more diverse anaerobic communities in their vaginal environment, which is, as you saw from the Human Microbiome Project, they were surveying healthy women. So they're picking up these, microbiomes that are dominated by all sorts of other organisms that can cause inflammation in the population of everyday women. So it's very common. It's not because you did something wrong or something wasn't done, but there are things that we can do to try to help foster the health of that environment because they're not producing enough lactic acid. And all of this, like I said, it's a population level observation. This is what we understand, but it's not an individual diagnosis. Everyone can shift and to take care of themselves and to be aware of what's going on and just, sort of live with that environment, because the whole idea around odor and everything should be perfect, like that is just a misnomer. We know that, right? And so understanding your biology can just help you take ownership over it and take advantage of doing things that will help you and that you can use as doulas to help your patients.
Right. So next slide. Yeah, so I think it's worth reiterating here. This is not genetic destiny. It's not a hygiene failure. No one's at fault. But these patterns track with all the things we talked about, your ability to get good care, how many antibiotics you've been given in your life, because each successive round of antibiotics makes it harder to establish a good microbiome. If you're living constantly in a stressful environment, if you're not getting good, nutritious food, all these things are going to impact the outcome here. And I think worth saying out loud that health system failures, not even factors, but let me just say failures, and the implicit bias that comes that, so many women experience further influences and negatively influences the care and outcomes that many Black women face. So, we say structural racism shapes many of these exposures over time. Some of it's biological and some of it is for sure environmental and the culture we live in. And never more than these days that we're in right now. So, so next slide. So this is really kind of an important slide. Kim, do you want to talk about this?
Sure. So bacterial vaginosis, I'm sure you've heard it many times, is a shift. It really does represent, based on what I was showing you with the CSTs and how we've been talking, a shifted ecosystem, one that is not necessarily associated with ideal health and protection from all the things we were just talking about. It's associated with chronic inflammation. Even if the woman is not experiencing symptoms per se, the underlying biology of a bacterial vaginosis microbiome is chronic inflammation. It could have ascending infection risk, and it's linked to preterm birth and miscarriage because of all of this. These organisms are inflammatory, and if you're pregnant and you have that dominant in your microbiome, they can affect the pregnancy. And this is exactly what is linked to the idea of increased preterm birth and miscarriage associated with an aberrant microbiome. So if your hormones aren't driving that lactobacillus dominant microbiome, there are also probably things one can do in pregnancy to help try to lower that pH, reduce the chronic inflammation risk, and restore health. And it's not antibiotic driven, right? You don't use antibiotics to wipe away these organisms and hope the good ones come back, because they don't always. So they can be helpful in a case where you need them, like with strep B or other organisms. But in a BV situation, it's really about restoring the lactate and restoring the lactate fermenting organisms in that environment. The way we treat it now is through antibiotics like metronidazole, but there's a missing link there, which is what we're talking about here, is like adding back those protective elements that the microbiome produces for you.
Yeah, so let's do the next slide because we have so much more to go. And this is really important too, right? Like as doulas, it's really important to understand that pregnancy amplifies everything, right? So you're growing a baby, all these cells are being created all the time. But like if you're in an inflammatory state, and also it's not easy to get pregnant in an inflammatory state. So that's another thing we didn't really say before, but a continuous BV microbiome makes it really hard to get pregnant too. But if you do get pregnant like that, then that inflammation gets worse over time instead of better. So, and you are also much more sensitive immune wise. So, I think this is really this thing to remember. Pregnancy does not erase prior biology, it magnifies it. So all the more reason that as you're working with your patients, that you want to get people back to a eubiotic, a healthy state during pregnancy as soon and as often as possible. Okay, go ahead. So, but Kim, maybe you could just talk about the risks. We're sort of beating a dead horse here, but I feel like it's really important for this crowd to sort of see.
Yeah, we really wanted to make sure that we were clear in explaining this in a way that was accessible, and so because it's a lot of complicated biology and science, but I think that through our discussion, hopefully it has become clear that it really is this aberrant microbiome ecosystem that is typical of bacterial vaginosis that is driving these long-term or these effects in pregnancy. So BV is very common. It can be absolutely silent. You might not have any odor, you might not have any itching or burning or discharge, but it still can be causing inflammation subclinically that you don't notice. BV affects 29% of women in the United States, but over 50% of Black women and versus 23% of white women. And that is due to what I was saying before, somewhat about the biology and also about all of the environmental aspects that we covered. 84% of that is asymptomatic. And this is linked to preterm birth, as we said. So 13.4 million babies are born preterm worldwide. In the US, it affects 10.4% of us, but 14.7% of Black infants versus white babies. And this is, again, because of the risk of bacterial vaginosis and all of this. And miscarriage is the other sort of effect that BV is related to, and that is having these organisms that we talked about before can increase miscarriage risk, all due to inflammation that is happening in the vagina and the located organs near there. So women with recurrent loss often have fewer lactobacilli, more disrupted microbes. So this is what we understand from the science that exists today.
Okay, next slide. Okay, but you can do something about it. So here comes the good news part of this presentation. And this is what I've spent most of my adult life studying. One of the things I learned, because I was very lucky to meet a biophysicist early in my career, is that osmolality, I mentioned this very early on in the talk, that the products you use have such a strong impact on top of all the other things we've discussed in whether they help you become more healthy or less healthy. And so what we know from this is like all the way back from over 10 years ago, a study that was conducted, and it was conducted because the NIH was trying to see if they could develop a gel that would make that would be more protective against STDs and HIV. And what they learned is that the vast majority of products in the market at the time actually promote bacterial vaginosis. So, I mean, if you use any of these products, KY warming at the very top of the scale, your risk of BV is 13 times higher. And if your risk is already high, then if you're using products that accelerate that, then like whatever, it's just bad news. So our product, Good Clean Love on the far left, is actually the same osmolality, or what we call isoosmotic, to natural vaginal mucus and sperm. So, and that's what you want. You want products that bring you back to what is natural in the body. And on the right side of this slide, you can see a histology study where you can actually see within 4 hours how at the very top there's like Good Clean Love is second and the control samples at the top, but KY warming at the very bottom, that is your vaginal epithelium completely shed within 4 hours. So there's no protection then, right? Like all this excess water gets dumped into the system. Your pH goes way up. I mean, you have BV basically in 4 hours. So next slide. And the pH, like we've said many times in this talk, is critical, right? Like in order to have good, healthy bacteria, you need to be between 3.7 and 4.1. And so many products, and it sort of mentions them underneath, actually pushes your pH up, even bar soap. And we have one doctor that we work with that's done serious long studies on just when women stop using bar soap, that improves their pH and also their microbiome in general. And this is why boric acid is recommended so frequently, because it is going to reduce your pH from those really high numbers, but it's still higher than you really want to be. So boric acid is not it helps. It can replace the use of antibiotics sometimes, but you still really need to do something to get your pH back where it belongs in the zone around 4. So next slide. This just shows like how we're the only product actually that's both isoosmotic and at the right pH. So, and I think if you did a study and you looked at all the products in the marketplace, there's maybe 2 or 3 others that would fit into that little box with us. A couple are from Europe because they do things well. But here in the US, we're pretty much alone. And this is what our biomatch patent is about, right? It's about isoosmotic so that we're not doing any harm. We're not shedding the microbiome, the epithelium, the vaginal epithelium, and we're actually supporting the pH by reducing pH so that that healthy lactobacilli can hang out there. Next slide. And so, yeah, Kim, do you want to talk about this one?
Sure. So, as Wendy was just saying, this is why product choice really matters. And it matters especially for Black women, given everything that we were just discussing about the vaginal microbiome and the environment and BV and the risk associated with all of that. And so, there's some new research that's been coming out over the years. And one of them was, even these products that are hyperosmolar that you use, for example, ultrasound fluid. So you use quite a large volume of that, but even in a pap smear, those lubricants are typically hyperosmolar, using not really great ingredients to put in the vagina. And so in this study of 80 women undergoing this transvaginal ultrasound using this hyperosmolar lubricant, it significantly increased their BV prevalence within 1 to 13 days, one-time ultrasound. And then when you look at that cohort, if you looked at a larger cohort comparison, because there are Black women in this study as well, these Black women who are exposed to this had double the risk of new onset BV. So most of this is occurring in women who already have a predisposition to have this issue. And so again, the kinds of ingredients that we put in these products that we use in standard of care are not good enough. And we're now understanding through these types of peer-reviewed studies that they're clearly causing increased BV risk, and BV causes increased preterm birth, increased preterm abortion risk. So even a single exposure, not even a routine exposure, a single exposure to this hyperosmolar lubricants can disrupt the environment, with Black women being the most affected. And that's just an example you can see of what's happening there, the sloughing off of the tissue, as Wendy was showing you previously.
Yeah, so the next slide. So what that's called is hyperosmolar products. So that means that the combination of the formulation, but one great call out is propylene glycol, or really any glycol, polyethylene glycol. These are petroleum-based ingredients, and when you have those, and not just in a lubricant or a vaginal gel or a gel that you might use for an ultrasound, but also in washes, right? Like there's lots of places that you see those ingredients come up, and they just create a cascade of reactions that puts you at risk, honestly. So really look at the products you have and that you use, and if you see watch out words like that, then drop those products and try something that is isoosmotic. More and more, we're sort of seeing people talk about their osmolality if they can, and if they can't, that means it's too high. So that's one way of knowing. So the next slide. These are the products that we recommend because basically it biomimics you back into an ideal state. So our balance wash and our restore gel, we also have a rehydrate gel. So it's a daily wash and a daily vaginal gel that helps to support the lactobacilli 3 ways. First of all, it doesn't disrupt anything, so that's good. And because it doesn't disrupt, we can actually do the work with a specific type of lactic acid, which supports the healthiest range of lactobacilli to reduce your pH so those lactobacilli can hang around. And the other product that you see on the screen here is the Reset, which is a suppository with native lactobacilli. So even if your body's not producing that lactobacilli, these are the kinds of lactobacilli that normally live in the vagina, like Kim was saying, Crispatus, Jenseni, the really healthy ones. And so if you just insert that a couple times a week and you're using these other products to maintain that environment, sooner or later, you're going to start to see that the system adopts that. I do want to say that this doesn't cure you for life. It only keeps you well so long as you use it. You know, what we see is that women will revert back to their natural state. I'm constantly kind of fighting with Kim about how it is that we can get this integrated into a microbiome. And truthfully, nobody knows how to do that yet. Not in the gut, not in the vagina, not anywhere. But, you know, we're going to keep working on it. I still have a few more years. So these are the products that we really recommend that all women that are pregnant would be using every day. And next slide. Kim, why don't you do this one?
Yep. So, I mean, it's really just talking about why this matters so much for you and for your clients particularly. So because they, you know, Black women face a higher BV risk and because of that, a greater preterm birth risk, you know, the differences in care quality and responsiveness, all of that also affects these outcomes. But using products that are not designed to support the environment that we just described to you in great detail are exacerbating the problem for these women. So using high pH cleansers like soaps, as Wendy was saying, ultrasound lubricants, which you may not be able to, you know, get away from right now, but eventually we should have lubricants for that support health and don't cause problems. But today, these kind of products or douching, things that, you know, maybe something that we learned from our mothers that should be good for you. These things are causing disruption and exacerbating issues that may already, you know, sort of exist in these women and make them worse. And so education and your product choices and what you're talking to your patients about matters. Using what Wendy was talking about, these microbiome respecting products help maintain the balance, can reduce BV risk. And even if it doesn't change your microbiome yet, as Wendy was saying, by putting the lactic acid there, you're immediately lowering the vaginal pH. And by doing that, the organisms that are there that don't like that pH stop functioning in an inflammatory way. So by continued use of that, you're putting this pressure of a low pH environment. You're making those organisms not happy. And so that's good for the patient because it basically is reducing inflammation and potentially reducing the preterm birth risk and all of that. Though we don't have data on that yet, that's the hypothesis and that's the idea. So by using these products, we can expect better outcomes for the pregnancy of the woman, for the baby, and for everyone's health.
Next slide. So we know that doulas already are making such a big difference in women's lives, reducing stress during pregnancy, providing a lot of education and informed support about like products and what they eat and all kinds of things, really advocating for women when they don't feel heard. So adding this last piece of really helping to protect microbiome health is going to just be a game changer for all of you. So, you know, we hope that this inspires you because the impact of the microbiome is so foundational to the outcome of a pregnancy. Okay, next slide. And these are just all the sources that we pulled together so people can get copies of that. But if I think we have some questions, right, Kim, that you have.
I think so. Yeah, I think Joy will.
Yep. So I'll be asking the questions today. So our first question that we have from our doulas that watched the masterclass last time is for doulas, how can they explain the vaginal microbiome in a simple, accurate way to patients that they're working with?
You want to try that one, Kim, or you want me to do it?
I mean, sure. I mean, basically, we talked about it ad nauseum in our presentation here, so hopefully they'll learn from what we said. But, you know, basically, the vaginal microbiome in a state of health is a protective microbial ecosystem that's helping to maintain vaginal health and pregnancy health. So it's an easy way to describe it to patients.
In simple terms. Thank you so much. Okay, the next question is, what are some common myths about vaginal health that you guys want to correct today?
Well, I think that there's a lot of ideas that you know, women are just born with a certain thing, or if they have these conditions or this odor or whatever, it's just something about them personally, right? And it's not. right? It's really about a bacterial profile, and there's things you can do about it. So, if you suffer with vaginal conditions, that's not like a life destiny, like we've said before, right? There's ways that you can create a really healing relationship with your vaginal health and really bring it into balance, which, is what we spend all our days trying to do.
I love it. So, one of the questions that we have is, how do sexually transmitted infections interact with vaginal microbiome health?
Kim, why don't you do
Yeah,
that one?
sure. Yeah, I mean, so it's as I said earlier in the talk, it's that lactobacillus in the vaginal environment keep it acidic, and by keeping it acidic, it's and those organisms are happy, they're flourishing, they're taking up space, right? So they live there in the environment happily, and by doing that, when you get exposed to sexually transmitted infections, they're less likely to take hold, because the environment is creating a barrier, if you will, to colonization by these organisms. So maintaining a vaginal environment that's low pH and healthy can help prevent against these types of things.
I love it. So, when should a doula encourage their client to seek clinical evaluation, just based off of maybe symptoms that their client is having and things like that vaginally?
I mean, so, the thing is that I think that a conversation about vaginal health should start on the very first day that you meet your client, right? And so you ask the questions about, how does your vagina feel every day? How does it smell? Do you have itching? Do you have discharges, right? There's a lot of clues that you can get before something's pathological, that there's something that isn't right. And like we said, many women might not ever know what right ever felt like even, right? So, suggesting the use of healthy products, usually women will see and smell a difference in just a very short time, within a week or less. So, making sure that women are conscious and aware of their vaginal health, I think is where that starts. And, generally by the time you need to go for a clinical visit, that means that, that the pain has sure reached a crescendo, or other symptoms are so loud that, likely what you're going to get is either an antifungal or an antibiotic, which still, like, that might help with the immediate symptoms, but it's not actually going to rebalance your microbiome, which is the goal ultimately here.
Okay, thank you. So, another question is, are there postpartum microbiome considerations after antibiotics, a cesarean birth, or perinatal trauma in any way?
Do you want to go, Wendy? Or,
No, you can do.
Yeah, I mean, I think basically, the trauma of birth is disrupting that environment, number one. So be it by cesarean section or vaginal delivery, there's different traumas that are resulting, but all of that, and the lack of, so the hormonal changes that happen postpartum are also part of the shifts that might happen in the vaginal microbiome. The idea of how do we care for our vaginal environment after these major events, especially if we're experiencing symptoms. If your body is self-regulating, then maybe you're fine. But if it isn't, using products like Wendy was describing, like a gentle external wash, the internal gel, once you're ready for that, can help shift things gently into the right ecosystem as you continue to heal. So I think that really would be my major consideration there.
I love it. So, what resources or handouts do you think is good for doulas to kind of give to their clients when they're talking about the vaginal microbiome? Do you recommend them looking at your website, or maybe is there?
Well, we actually have put together, I think, a one page for this topic, or didn't we? I think we did.
We did. Yep.
So I think we have a resource that you can get on our website, Institute for Vaginal Health. And it's downloadable, so you can print it and hand it out. Yeah, we're really excited that we're going to soon be launching a new clinical clinical care platform. It's
Love
called
it.
Good Clean Clinical Care, and that's a telemedicine platform. So that's a place where when women really need medications, we're delivering those in our Biome Nourish system, which is basically all the things we just described about keeping a microbiome healthy and strong. So if you need antibiotics, for instance, you'll soon be able to come onto our website and get them locally in a base that isn't going to harm your microbiome. So we're really excited to have that launch.
I love it. So I have our last question for us. This question is about breastfeeding and the role it plays in the changes of vaginal tissue and just the environment of the microbiome.
Mm-hmm.
I'm going to leave that one to you, Kim.
Okay. Well, yeah, I mean, so breastfeeding, of course, is like, I think always immediately about the impact to the infant's gut, because I've also studied that to a great degree. So it's super important for the development of the baby, but also for helping your own body sort of recalibrate into where are you now in your pregnancy journey, if you will. So I think it's a very good idea from a standpoint of, there's no direct impact of breastfeeding to the vaginal microbiome, at least in the literature that I'm aware of. But we all know that these natural sort of ways that our body evolves through pregnancy influence our inflammation, our immune system, both the mother and the baby, because there's crosstalk that happens actually between the baby and the mother too. So I would say if she can breastfeed, then that would be ideal both for her and for her baby. The vaginal microbiome, however, directly may need hygiene care, like we were saying, in terms of products and other things to help really drive that forward. But it always helps to breastfeed, I think.
I love it. Thank you so much, Kim.